Hi, this video is the art of hair transplant restoration surgery result for 1 year post-op with before and after photo by Dr. Diep. This client has a receding hairline and corner, and we are trying to recreate his hairline. No hairline straight, so we do zigzag through it. So on average, from the eyebrow to the hairline for Asian is 6.5 to 7. Same thing for Caucasian, Asian, Black and Asian, and Caucasian is around 7.5 to 8.5 centimeter. And then the more narrow the face, the more arched back the hairline is. The more round the face, the more flat the hairline is. So once we get the shape down, we zigzag through. These straight lines are just imaginary line. There's really no line because everything is just a blurred line, zigzag through, just like the movie. And once we get the shape down, we will transplant at a very precise angle at 35-45 in the front. Increase when you go backward and change it when you go different direction. Not only the precise angle is important, the selection of hair graft is important. We transplant rows and rows single hair graft in the front, follow root by the root, go 2 hair, 3 hair, 4 hair in the back for bulk and volume. The goal in the back is for volume and density. The goal in the front is for softness and naturalness. So you don't want to transplant root to go 2, 3, or 4 hair in the frontal area. You always transplant root to go 1 hair, and that's reduce the chance of dimpling and all the chance of harsh hair graft which might be detectable. We will be harvesting around 2,000 grafts using the FUE method. As you know, FUE is the most advanced technology available and the least invasive of the two. It is the future. More and more clients opt for the FUE method. The strip method is fading away, but it still is very, and I still do both FUE and the strip method. And so for the patient with a mild to moderate hair loss, I highly recommend the FUE method. Why? Because it's less invasive, less bleeding, less chance of infection. It leaves the scalp intact. We're just pulling one root at a time in the back. So it leaves tiny dots of scar, allow you to shave your head shorter, which less detectability. So when you bend down or you go to a gym, not many people are going to detect with the FUE scar. Versus the strip method, whether it leaves you a linear scar running from one ear to another ear. Now for the strip method, again, I do still perform that procedure, and I know that method is still effective and it is good. Now, for a client with advanced hair loss, where you lose all the hair from class 4, 5, or 6, or 7, now class, very advanced hair loss where you complete bald on top, and you need to move an immense amount, a large amount of hair graft per day, such as 5,000 to 6,000, then the strip method is more beneficial. Why? The strip method is very efficient of harvesting large number of grafts versus the FUE. The maximum I can do a day is around 2,500. Although there are days I can go 3,000. So if a client with advanced hair loss, they more often than not opt for the strip. However, some of the clients with advanced hair loss can still do the FUE. Just need to know that you're going to do multiple sessions. 2,500 will tend to cover almost half of your head, and then another 2,500 that will cover some in the back. So with the advanced hair loss, the strip tend to get there with 1 or 2 surgery. With advanced hair loss, the FUE need to be done in 2 or 4. Both method works very well, and because with the improvement and advancement of the FUE, more and more people are doing bigger case, around 2,500 to 3,000, and again, it's all individual. Of course, the FUE is more expensive than the strip method, but with my work, you could have excellent result, very dense. It doesn't matter FUE or the strip method. For the client who for the clinic or surgeon who not specialized in the FUE, there's a big contrast. The FUE result won't be the same because they won't be able to harvest the healthy hair graft. And when we talk about the FUE, not everybody does the FUE the same. There's 3 different groups. There's a group that a surgeon who specializes in the FUE, harvesting the hair graft by himself or herself. And so the most critical question you should ask the surgeon who doing FUE, are you the person who personally pulling the hair graft out? Because if you ask, are you the one who doing surgery, even the surgeon who does not pull the hair graft out, they claim to do the surgery, but because they make sight and all stuff. So the most critical question is, are you the one who pulling the hair graft out one at a time? That is the FUE specialist, and they tend to produce the best result. Another group of surgeon or clinic, they cannot do the FUE. They can do the strip, but they cannot do the FUE. So they buy this machine called the robots, the artist or robot. The robot cannot harvest the same amount of healthy graft as at least I would do. Even though they advertise to have the least transaction rate, but the graft is not healthy, and I don't believe it's the least transaction rate. With my work, I personally produce it, and I'm personally pulling the hair graft one at a time, and it's less than damage to the root, and that's why my hair graft for the FUE is a lot more dense than the robots on the knee graft. The knee graft is the third group, and it's completely the whole hair transplant done by the technician, and of course they are not surgeon, so not even doctor, so it's no comparison. And so that's why FUE, the most critical is to make sure the surgeon is the one who personally pulls the hair graft out, and how often he does the surgery, FUE. If he does it once a month, once a year, of course quality is not the same versus a guy like me where we at least 4 times a week or 5 times a week will perform FUE. So I'm very excited about this client because 2,000 grafts, and a year later he will look completely different. Once we have a lower hairline frame the face, it will bring out his look, his eyes, his nose, and all the features that God created. Once the hairlines rise up and the forehead is larger, the looks kind of change. So this is the art of hair transplant restoration surgery, restoring the hairline using the FUE method. Thank you.